Good afternoon, everybody. Welcome to the United Nations Interpress Service webinar on the impact of COVID-19 on women and girls. My name is Doa Abdelmotal. I'm advisor at the Guarini Institute of Public Affairs, and I will be moderating this debate. Let us begin with a few welcoming remarks from Farhana Haq Rahman, Senior Vice President of IPS and Executive Director of IPS North America. Farhana, over to you.
Thank you. Welcome to the IPS Interpress Service. The impact of COVID-19 on women and children. We are very grateful to our distinguished speakers and moderator for their availability, and thanks to everybody who. There is an enormous wealth of knowledge and experience assembled here. We want to hear about your experiences and expectations and what you believe could be concrete actions that will accelerate positive change for women and children. You are the leaders, practitioners, and advocates from all regions and various backgrounds. You are our champions, and we need you to be mobilized and to mobilize others. While official responses to the COVID-19 pandemic have been broad and unprecedented, concerns are mounting that their outcomes may exacerbate and widen existing inequalities. This must alert us to women and girls, too often subject to inequalities, who now are at risk of more relative disempowerment due both to the pandemic itself and to the policy response. In simple terms, this is the who shops for groceries question. More insidiously, with lower household incomes, many women have to shop more extensively to economize and find affordable nutrition, and thereby increase their exposure risks while also reducing their productivity. Evidence from outbreaks similar to COVID-19 indicates that women and girls can be affected in particular ways and in some areas face more negative impacts than men. In fact, there is a risk that gender gaps could widen during and after the pandemic, and that gains in women and girls' accumulation of human capital, economic empowerment, and voice and agency built over the past decades could be reversed. And who is looking out for documenting the trauma faced by women and children in the developing countries? I hope this webinar adds to our list of what to pay attention to. And before handing back to Doa, I want to say a special thanks to our board member, Naima Nusrat, our IPS colleagues, Mauro Theodori, Margit Sroor, and the technical team led by Shaun in Dhaka, Bangladesh, for their work behind the scenes to make this webinar possible. Thanks, and over to you, Doa.
Thank you very much, Farhana. Thank you to you and to IPS and to the entire team behind the scenes who has made this webinar possible. This topic is crucial, and it is truly fantastic that you've decided to shine a light on it. Now, we're gathered here today to discuss a topic that unfortunately is all too often neglected, and it's the double, triple, or even quadruple inequalities that women and girls face in emergency situations. An impact that necessitates the application of a gender lens, not only to the COVID-19 crisis, but to all crises more generally. Now, studies have shown that men are more likely to die of the coronavirus than women. But studies are also showing that women are bearing the brunt of the social and economic fallout of this pandemic. And this is what we're gathered here to discuss today. The reasons for this are multiple. First is the fact that women comprise 70% of the global healthcare workforce. And as we all know, a lot of the healthcare workforce is falling sick during this pandemic, which means that a lot of women are falling sick. It is said that in the US today, 3/4 of the infected healthcare workers are women. Furthermore, women are caretakers within their homes, and we can't forget that fact. During the Ebola crisis in West Africa, women represented 2/3 of all those who were infected because of their increased exposure in caring for their families and in caring for patients. Furthermore, when a family member got ill, women were often stigmatized for not having kept their homes clean enough. Second, the issue of maternal health care. Women are not able to access critical maternal health care at times of crises, when healthcare workers are overwhelmed with whatever else is going on. During the Ebola crisis in Sierra Leone, there were 3,600 additional maternal deaths, prenatal deaths, and stillbirths relative to normal times. Third, girls have to overcome multiple hurdles related to access to education and to learning relative to boys. Around the world today, only 34% of girls in the poorest households complete primary school. Young women are nearly 90% more likely to be out of secondary school than their male counterparts. Fourth is the very difficult issue of physical and sexual violence. 35% of women at the global level report that they continue to experience physical or sexual violence, according to UN Women, a situation that gets exacerbated by times of emergency. And in this pandemic, unfortunately, there has been no exception. In fact, we've seen reports of spikes in domestic violence during COVID-19 in countries as far apart as China, France, the United States, and so on. Finally, women perform 3 times the amount of unpaid work that men perform, and therefore are more exposed to the economic fallout of the crisis. When a woman is furloughed or loses her job, she may be losing what was already very little income. With us today is a very distinguished panel to explore the dangers of neglecting the gender dimension to the COVID crisis. So let me, without further ado, introduce our panelists to you. Catherine Bertini is Distinguished Fellow at the Chicago Council and former Executive Director of the United Nations World Food Program. Hello, Catherine. Yasmin Sharif is Director of Education Cannot Wait, a global fund for education in emergencies and protracted crises established by the World Humanitarian Summit. Welcome, Yasmin. Saima is advisor to the Director General of the World Health Organization on mental health and autism. Welcome, Saima.
Oh.
Susan is Managing Director of Policy and Advocacy of Women Deliver, an organization championing gender equality, the health and rights of girls and women. Hello, Susan. And Josefina Stubbs is former United Nations Assistant Secretary General and Vice President of the United Nations International Fund for Agricultural Development. Welcome, Josefina. So as you can see, I couldn't possibly be in better company. In this webinar, I will be putting 2 rounds of questions to our speakers, after which I will be taking questions from viewers. Questions have already started to trickle in before the webinar, and more I'm sure will do during the course of the webinar, and we will be happy to interact with our viewers. I would like to note that it's a pleasure to have women from so many different continents on this webinar so that we can hear of the different, not only types of problems that women experience, but also the different geographical settings in which they happen. Catherine, let me start with you. You were the head of the World Food Program for a decade. So nobody knows more than you about humanitarian emergencies. What can you tell us about the disproportionate impact of such emergencies on women and girls? And what are you seeing as a result of COVID-19?
Thanks so very much, and thanks for including me. In 1995, in Beijing at the Women's Conference, I gave a speech titled "Women Eat Last," and I say that because just yesterday, the deputy of WFP, Amir Abdullah, told me he had been recently at a gender awareness seminar talking about a report about the Rohingya in food assistance. And one of the conclusions was women eat last. Now, what have we been doing for 25 years if this is still a tagline for what's happening in the world, especially for women in crisis? But in fact, that is often the case. And it's not just because women are in crisis, it's because so often in its societies, the women who prepare the food, who gather the food, who grow the food, who find it somewhere, even if their families are desperately poor, are the ones who prepare it and then serve it. And they serve it first to their husbands and boys. So some things take much longer to change than we can possibly change. But the point of ensuring that everyone in the household has access to food is still critical. And it's critical even whether somebody's living in dire poverty or on the brink. And those people on the brink are what WFP and others are seeing now, because it was estimated that earlier, beginning of the year, end of last year, there were about 80 million people who were desperately in need of food and may not survive. And Reef Hussein, the chief economist of WFP, wrote recently that it's now up to 135 million. And by the end of 2020, that number could be 250 million people. Now, there are a lot more who are at risk, but these are people who need food today in order to survive for tomorrow. And of course, these issues come because of the physical access, economic access, transport issues, production issues, all sorts of issues related to the follow-up of the crisis of COVID-19, in addition to wars and all the other issues that the very poor have to deal with in so many places. So what's being done about that? Now WFP is appealing for $5 billion to try to help people move from that state. And they want to be able to serve 138 million people, but that's a huge amount. It's never been, that kind of amount has never been requested before. And of course, it's worldwide. And we look at women and girls specifically. For a long time, WFP, and this is something that we started during my tenure, have been trying to pay attention to women, because we asked, wait, we're not just moving food around, we're trying to end hunger. So who's the partner who's best served to do that in the household? And of course, the answer are women and girls. So a lot of WFP, the majority of WFP food that is distributed through women and girls, through the senior female in the household, for instance, not exclusively, but as a priority. And in the process, they're trying to deal with other issues, trying to make safe spaces, for instance, for women to be able to accept food and move it home. Trying to get access for women in places where it's not easy to have access for women. Trying to do more training for women so they could be able to use that food, be able to build on, be able to improve their own incomes, and then working on issues like titles and savings and so forth. Because in fact, with COVID, all of the issues that have been problematic for women and girls throughout the world, throughout time, have, instead of becoming better, become worse, because they're worse for everybody. And the pressures then become worse, as Dua just talked about in different ways. So I think those are some of the ways that humanitarians can help, not just the World Food Program, but NGOs and UNICEF and many other organizations throughout the world who are trying to support women. I saw an interesting title yesterday in the New York Times. It said, the title was, "In the COVID emergency, you can have a kid or a job, but you can't have both." So the issue of childcare, the issue of what to do with children, is probably going to be one of the most important issues that women have to deal with in any society, and whether they're desperately hungry or not. I like to think that when this all settles down, that maybe one of the silver linings we'll see is that many more men understand the needs of childcare. And maybe it will mean that there will be more emphasis from a policy perspective to put on childcare issues and childcare facilities in the future. So in COVID-19, the disproportionate impact to women and girls is magnified many times over because of their roles as caregivers, as mothers, as cooks, and ultimately as the people who are holding the families together. Thank you.
Thank you very much, Catherine. Indeed, alarming words. Women eat last. Clearly a situation that must absolutely change given the critical role of women and girls in food systems. The injustice of it is just difficult to even listen to, frankly. Questions have rolled in after your brief presentation, Catherine, and we will come to them in the Q&A, questions from viewers. Yasmin, let me turn to you. Education Cannot Wait, your organization, is founded on the premise that the world cannot afford to neglect education. Across the globe, we've now seen schools being shuttered in the wake of COVID-19, with experts warning that the poorest and most vulnerable children frequently never make it back to school post a crisis. Are you at all concerned that this may be the case here?
Thank you very much. Thanks a lot, Doa. Well, Education Cannot Wait, as you know, was established at the World Humanitarian Summit, and we are a global fund. So we are not an implementing partner, but we're a global fund that is hosted by the UN system in UNICEF, to be more precise. Are we concerned? Yes, we are. A recent study that came out of the Malala Foundation estimates that another 10 million girls may never return to school. And our area of investment is in crisis and in situations of forced displacement. So countries of conflict, natural disasters, and forced displacement. And out of the 75 million children and adolescents, 39 million are girls. And if you were to look at the estimates by the Malala Foundation, we will actually have another 49, a total of 49, close to 50 million girls in those countries who may not return to school as a result of COVID-19. You see, in a country of conflict or refuge, speaking Central African Republic, Chad, the Sahel, Afghanistan, the Rohingyas, education is both there to help and empower the girls and the adolescent girls, and it's also a protection mechanism. It keeps them away from having early child marriages, keeps them away from having children when they are children themselves, 12, 11 years old. It keeps them also in a protective environment from getting caught into trafficking and that whole war economy that often comes about as a result of a conflict. And also during crisis, and especially during now with COVID-19, you see an increase of gender-based violence. So if they don't return to school, I mean, they are affected in a triple way. First, they're affected by the conflict themselves, the violence that was there before COVID-19, and the fact that they were forced to flee. Secondly, anyone affected by a conflict or a crisis often suffer extreme abject poverty on top of it. And as Mrs. Martina was saying, it's also an issue of hunger now that I think World Food Program has come out very strongly to make clear that that's one of our biggest threats of COVID-19. And then you have the consequences of being in refuge or being in a country of violence. And of course, it's always the girls and the adolescent girls that suffer the brunt of that for so many reasons. And COVID-19 just becomes an additional burden. Just take a country like South Sudan that gained independence a few years ago in the mid-2000s. And of course, we hope that peace will eventually come to South Sudan. But 72% of primary school age girls do not attend school. And this was before COVID-19. So we are really speaking about an education crisis that was there well before we had the health crisis, the COVID-19 crisis. And if we do not invest in education and in girls' education, we are going to leave behind 50% of the world's population, and 50% of the world's population affected by conflict and disasters. And that can only perpetuate the vicious cycle of crisis, conflict, hunger, and poverty. Unless we invest in girls and in women, we cannot speak about sustainable development. We cannot speak about recovery from COVID-19. So yes, we are very, very concerned. But there are ways to change that, but I'll keep that for the second question. Thank you very much.
Thank you very much, Yasmin. So basically, what your comments mean is that a pandemic or a crisis like the COVID-19 crisis that we're experiencing now can not only create new problems, but it can roll back progress. And that's quite frightening. So, you know, the few extra school seats secured for women and girls in conflict-affected regions or developing countries in crisis, those school seats then disappear at a time of crisis and have to be regained. So some of it is about rebuilding, unfortunately. Saima, I will now turn to you. As advisor to the Director General of the World Health Organization, you know all too well about how pandemics can take their toll on the mental health and well-being of people. Describe to us what you're seeing as the impact of this pandemic on the mental health of women and girls.
Hi, thank you so much for inviting me and bringing up the issue of mental health as a core concern. I think under the circumstances, we're seeing all over the world that not just the fact that we're all under this, having to go to various phases of lockdown, we're trying to deal with this pandemic that we don't know where things are going. Women have the added responsibility of being the homemaker, the teacher, are the first ones to lose all of their other choices for, small income sources that they may have had. So it is having a huge toll on women's mental well-being. But I think in some ways, the way we have prioritized mental health for women in Bangladesh and made it a part of our system of care during a crisis situation, as part of our health system, has really worked. There are outreach, telehealth, there are a lot of support systems that have been created, practitioners that have put themselves forward. There's education that is happening in the community, and that all, making it accessible from the home. So in some ways, what we're seeing in Bangladesh, women are, in fact, there's a lot of support system in place for them that they can reach out to, because it was always designed to reach from their home situations. And, in general, I think women are much more resilient to a lot of changes and are problem solvers in the family. So they are in some ways better served, especially because as the numbers and the data come out, they are hearing that they are less at risk. So I don't think, and with this global crisis, that women's mental health is at greater risk as of themselves. However, we have a major concern with the growing number of domestic violence and the economic hardship, which ultimately we have to realize ends up, the women are on the receiving end of that frustration of anything, not just of their the husbands or the fathers being in situations where now they're not economically, they're not employed, they're not busy, they're frustrated, but also having to manage the home and the household with you know, children being at home, trying to make do and ensure that there's sufficient food for everybody, you know, make do with what is being given to them. So you know, it is a concern always for women's mental health, but in the last few years, how much we talk about it, we prioritize, that is making a significant difference for how well women can be served. Again, we are very fortunate in Bangladesh that we have a lot of safety nets already for women. Our community clinics have been kept open. Our healthcare maternity wards have been kept open all the way in the community. So women who are having children and childbirth, they have, you know, they have been prioritized, and they have safe, secure places that they can access. And knowing that, having known that prior to the crisis, has gone a long way. What again is harder for women is that the community of women that they've always relied on. And in countries like ours, as much as we've invested in technology and it's accessible, it's not always really available for them. And there's less opportunities for women to you know, utilize that. You know, I think women as a whole, a huge part of women's mental health is reliant on, you know, sharing your, not just your chores, but sharing your worries, sharing your solutions. Women are a community into themselves. We support each other. And so not being able to access that, I think, and having that option, having that outlet really kind of impacts. I think all of us, we can relate to that regardless of which, where we live. One of the things though in Bangladesh that we've noticed, and in the rural areas, there's less fear. There is more of a sense of community, because the rural communities themselves tend to be more supportive. The home environment tend to be more, you know, fluid. There's, you know, people going back and forth, but just the way the homesteads are structured are very different. We who are living in urban settings are very much reliant on being, you know, we're more closed off. You know, in our sort of like concrete structures, and that I think significantly impacts, you know, both the emotional health and the social community that we have, you know, built around ourselves. So.
Thank you very much for those remarks. And you're right that women rely on communities, of course, for their strength and resilience, and as a source of resilience. Of course, a problem with that in COVID is the fear of contagion now, where you're scared to be part of a community because you're scared of getting infected, and so it's reducing these traditional sort of networks of support. Susan, let me come to you. In Women Deliver, you communicate from podiums, boardrooms, and throughout the hallways of power that women and girls must have equal rights. What, in your view, is the COVID pandemic doing to those equal rights?
Thank you so much for having me today. It's really a tale of two sides of gender equality. On one hand, we are seeing women rise to the occasion. Women's leadership has been exemplary. And on the other hand, we're showing widespread deepening inequalities. As many of you have seen in the media reports, although it's not quite a universal truth, during this pandemic, women leaders have tended to have a more holistic approach to combating the virus and keeping their citizens safe and healthy, including the health and rights of girls and women. And I'll give you a few examples. In Taiwan, they have a female president, Ma Ying-jeou, and she's been cited for her exemplary ability to curb the pandemic. This is a country that's less than 100 miles from mainland China. It has 24 million people, and yet Taiwan has only had 449 confirmed cases of COVID and only 7 deaths. In New Zealand, under Prime Minister Jacinda Ardern's leadership, she's been able to successfully curb the COVID crisis, and she's also included provisions that prevent and respond to gender-based violence. And she did this from the start. She anticipated what was coming down the road. And in Germany, Chancellor Merkel has also committed to increasing funding for shelters and other resources. So women are taking a more holistic approach to their response and recovery. But women aren't only showing that leadership in the halls of power. They're showing that on the front lines every day. As you said in your opening, women make up 70% of the global health workforce. And this means that they're the majority of people responding to COVID. And examples of this leadership include women like Nargis Sergahe. She's an Iranian midwife who, when COVID hit, she organized her fellow midwives online to help ensure that pregnant women were able to continue to get the services that they needed. And my sister is another example. She's an obstetrician here in Ohio, and she's balancing the responsibility of working nights in the hospital delivering babies with extra safety protocols and putting herself at great risk while also caring for her family. And most recently, she's added the role of teacher, where she's homeschooling her kids during the day because the schools are closed. These are all examples of leadership. But while women's role in the response and recovery is clear, it's also exacerbating entrenched inequalities. And I'll give you 4 quick examples of this. First, we're seeing the same women who make up the majority of the health workforce also putting themselves at increased risk of exposure to the virus. And this has been exacerbated by continued shortages of PPE. And just this morning, there was a news article out of Kenya that showed the 15 nurses from the Pumani maternity hospital tested positive for COVID-19. Second, we're seeing that a global lockdown has meant that there's been increases in gender-based violence. In the UK, for example, the number of domestic homicides has grown 3-fold since March when you compare it to the same death rates from last year. And third, we know that in health emergencies, oftentimes resources are diverted away from essential services. And this also includes sexual and reproductive health and rights. This, let me be clear, is an essential service. Women are going to die as a result of these services being curtailed. And history is a lesson of this. As we saw from the recent Ebola outbreak, which you cited in your opening, women experienced a rise in maternal death. And this is because it created constraints and staffing shortages and supply chain disruptions and access to critical medicines and a decline in family planning distribution. For example, in Liberia, family planning products declined by 65%, and in Sierra Leone, family planning products usage declined by 23%. We're starting to see these challenges arise in COVID as well. And finally, as many of you have already touched upon, the increased burden of care work and the challenges that women face in the informal economy. The ILO has said that women are more likely to include informal employment in many low and middle income countries. And this means that they're also in positions of greater vulnerability. These women are less likely to have social protection and services that there can only really be provided with informal employment. And that's because the social safety nets are not strong enough. So these women are denied access to things like paid sick leave, healthcare, and protections from workplace harassment. So as I said, it's really a tale of two cities. What I think is even more striking is when you look at across the spectrum of women, the disproportionate effects that women of color and Indigenous women are being faced by COVID. For example, data from England and Wales shows that Black women are 4.3 times more likely to die than white women as a result of COVID. And data here in the US paints a very clear picture that racial inequalities across the country are rampant. Black and Latinx women are 3 times more likely to become infected than whites, and they're twice as likely to die from the virus. So in short, we're seeing powerful leadership on one side, but also a deepening of entrenched gender, social, cultural inequalities. And this is why it's so important to ensure that girls and women are on the agenda and that they remain at the center of that agenda, and why we must apply a strong intersectional gender lens to COVID response and recovery.
Thank you very much, Susan. Indeed, thank you for bringing in the issue of race as well, which plays a very big role. Women are vulnerable as it is, and then you add the racial dimension to the problem, and it becomes much more severe. Josefina, let me now come to you. From your many years of experience in the development field, talk to us about violence against women and how that violence can be exacerbated in times of crisis.
Yes, thank you, Dawn. Thank you, everybody, for connecting to this conversation, which I'm very happy that we are having, and we have to have them more. I believe that we haven't spoken enough about the gains that women have made in the last 2 decades and the enormous risk that we are now seeing of those gains being lost. I want to speak basically about Latin America, in which we all know that inequality has been one of the largest problems the region has had for decades. In spite of the big economic growth that we have in the region, more than 35% of the Latin America population lives in poverty and under poverty. And that middle class that has been formed, quote unquote, in the last years is people who have between $5 and $10. And you can imagine that in this crisis, we will see a lot of those going down again. Latin America, in fact, as we speak, the pandemic is evolving. I'm sure you have seen in the newspaper how hardly hit it's been. We are expecting, at the beginning, the calculation is that we will have 30 million poor people, or people going down the poverty line as a result of the pandemic. And what does it mean? I mean, we know that in a region like Latin America, even though women have been made some progress, in some countries in Latin America, 45% of the households are headed by women. And we all also know that among those households headed by women, they are the poorest of the poor. For every 100 men that have access to credit, 57 women have access to the same right. We do have in Latin America, is very well known, a very high level of violence. And only to give you an example, in 2018, in 19, there were 60,384 cases reported in Mexico on violence of all types. Many of them sexually driven, gender-based, definitely, and 85% of those cases came from your partner, your life companion in your household. So I think that what we are very worried in Latin America, because a lot of the gains that have taken the women's movement, the government, international agencies, a lot of effort on education, on health, on economic rights for women, etc., can really go down the drain. And we know, we women, how hard it is to come back again to where the crisis hit us. So there will be a lot of work for us to do. What we are seeing in the case of Latin America is that indeed the pandemic is exacerbating already economic inequality. It has made care work at home much more burdensome for women, 45% living as single head household women. And of course, the issue of gender violence, which I'm coming back to. But there is another issue which is really worrying us in Latin America. About 75% of the informal sector in Latin America is led by women, which means small and medium enterprises that give the women the economic autonomy and the empowerment for them to make decisions in the future. Those small and medium enterprises are really suffering, and most of them are led by women. But also, you see, we take the case of the service sector. Our economies in Latin America have moved more and more into the service sector and the tourism industry. 75% of all workers in the tourism industry in the Caribbean are women. they are already out of work, which means women are losing not only in terms of job security when they have a low-paid job, but they will also lose the security of an income, which to a large extent is a safety net for women who are suffering violence. We have seen in Latin America, like in many other places, an increase of violence in El Salvador. Argentina has seen 25% of domestic violence reported officially. In El Salvador, we have 42% increase of denounces everywhere in the country. And in Mexico, 50% of the calls for help during the lockdown. Imagine you are locked down with your abuser, 50% increase in denunciation of violence. I have to say at the same time, as my colleague said, that the civil society within the lockdown has done a lot of work. And we have a number of very innovative models across the region, which are trying in the middle of everything to try and protect women. The use of technology has been absolutely essential. There is a wide connectivity around Latin America, and some hashtags in Mexico, Ecuador, Argentina, and Colombia have made an enormous difference because women cannot go out or because their cases cannot be followed because the judiciary system is closed. So it's a very complicated situation, but the media, the social media has played a very important role. In some countries, the shelters have been declared as essential service. In others, it has not. So in those cases where the shelters have been open, the problem that the region is facing is that they are at the moment full. So in some Latin American countries, they are asking for opening alternative places where women can go. But you can imagine that in the middle of all this crisis with so many people and I mean, health systems that cannot really cope with this size of emergency is becoming much more difficult. The conditional cash transfer that some of my colleagues mentioned has been fundamental, as well as the cash transfer, but also linked to food and other benefits, because that keeps the women at home, but also because the conditional cash transfers have been mostly focused on women as an entry point, women are still the recipient of the cash that is keeping the family at home as much as possible or buying food. Now, for rural women, the situation is very complicated. If for the urban areas, we have, I mean, faulty and weak and insufficient health coverage, imagine for the rural sector. Community leaders, again, connected to internet, are helping, are becoming actors, not only recipients, and are making sure in some cases that they keep accounting of the people that fall ill in the households so they can report it to the authorities. I'm sure you have seen the numbers in Bolivia, in Ecuador, and the even more horrible situation in the Amazonian. And this brings me again to another issue raised by one of our colleagues. Afro-descendants, indigenous people, including indigenous women, are being really hardly hit in Latin America because they are the poorest of the poor. And within that, the health system is not really reaching out to their communities, which is a very critical situation. We will see when the pandemic sort of closes and the lockdown process closes because we don't have enough numbers, which is another problem. We don't have the statistics up to date. We don't have them disaggregated. We cannot really monitor what is happening for targeted responses because the data is not yet available. I'll leave it there for now, and I'll come back to the second part. Thank you.
Thank you very much, Josefina. I think your comments are extremely interesting in that what you seem to have linked is poverty to violence, to the general condition of injustice against women. I think economic empowerment is key to pulling women out of these very difficult situations. And I hope we can see more focus on that after this crisis. And of course, the fear is that the crisis has now plunged us into an economic recession. Your comment on data ties in nicely with just a few words that I would like to say as an African and an Arab on this webinar. Very often we don't think of our political systems as having to do with the problem. But I think that in countries that are not democratic, where democracy is insufficient, where there's insufficient attention to human rights, where civil society isn't active enough, where free speech and the free press is stifled, we hear even less about what is happening to women. You mentioned data, Josefina. I think in the Arab world and in a number of African countries, the data issue is fundamental, and it comes from the fact that there are political systems in place that are not allowing people to report, that are not allowing for these problems to surface. This was an extraordinary first round of questions and answers. Thank you very much to all of you. Let me now come to our second round of questions. Yasmin, I will start with you. You've just penned a fascinating op-ed on COVID-19 and education, calling upon the world to build back better, using education as the foundation for the construction of a new and better world. How can we prioritize education at a time of crisis? Is it possible to do so?
Well, if we don't prioritize education, we are going to create a crisis. Without education, you cannot rebuild. And I think the whole point is that what we have done over the past decades or over the past 100 years in terms of humanitarian assistance or development, it's been very much filling holes. And we still keep populations down. I mean, I think COVID-19 has shown us the enormous socioeconomic inequity that we have between the North and the South, between those who have and those who don't have. And here, when you look at countries affected by conflict and crisis, and half of the population being women, the only way to arise out of that crisis once and for all, and the only way if we really want to empower women or any human being, is a good education. And it's an education that is a quality education, that is holistic, and that goes beyond just primary education. All of us here today in this seminar are here because we have been through an education. The best way to defend a woman's right is to make sure she gets the proper education, she becomes financially self-reliant, she has an education that allows her to be a political voice, an education that allows her to have the confidence to speak up in face of injustice, to have an education that allows her to stand up on her own. That's the only way to liberate a woman from the yoke of oppression, and especially in countries affected by conflict. When we have dictatorships, we have corrupt governments, we have governments that rather put their finances into security and defense and army or in the war machinery rather than educating the new generation. The only way to overcome that is not with more violence, but through education. And the same then applies on girls and women. And if we are going to rebuild, we need to start with the foundation of investing in the human mind, investing in the mind and the heart and the soul of women, and give them that empowerment. And that will eventually lead to the empowerment of their daughters. I mean, statistics show that a woman who has gone through secondary school is more likely to have daughters who will go through secondary school and eventually through tertiary education. The best way to keep women down is to make sure they never go to school. And it's to make sure that they don't get educated. Because then they will be doing the traditional occupation, and that will be also the punching bag whenever a crisis hits. So I think, and here on Education Cannot Wait, that's what we do. And I think it's important to say we are not one organization. We work with WFP, with UNICEF, with UNESCO, with civil society, with Save the Children, with Plan, and with governments to invest in the 40 million girls and adolescent girls today in the midst of COVID-19, before COVID-19, and even more now, to make sure that they don't lose out on their education or any quality education, the protective mechanism that comes with that. And we do it through affirmative action. When we invest in girls and women, it's not throwing it out there and just in case they show up. It's affirmative action. In Afghanistan, if you go back to the Taliban era, girls were completely out of school. Those who went to school went to underground schools. Today, all our investments, which are with UNICEF and Save the Children, working with the government and in line with the government's policy of girls' education, 60% of the students in education cannot wait investments are girls today. So you can't turn it around. They're going to be the future political leaders of that country. They're going to be the future engineers, the future doctors, the future nurses, and the future teachers who are going to teach the new generation gender responsiveness and the respect, and teach the new generation of boys to respect their women and their girls and their sisters as equals. So I think it starts with education. I think education can never be under prioritized in a crisis, because it means that we are only filling holes, so trying to stitch together an already torn apart fabric. Building back better means investing in the human mind. It can be done through affirmative action. Data is important, access is important, but what is really important, and that's why we exist, is to have the financial means to deliver education. And that means more than $100 per child. It really means that international, bilateral, and multilateral strategic donor partners, foundations, private sector come in and contribute so that we can develop the minds and the souls and the hearts and give the tools to the women and the girls who are left furthest behind in conflict and crisis. And to end with this, I do believe that girls and women who live in conflict and crisis, like Afghanistan, like the Democratic Republic of Congo, in Colombia, and I've seen many of the Venezuelan refugees who are being actually well looked after by the Colombian government, they have suffered so much because they have been discriminated against because of the gender. They have suffered because they have been held down and oppressed as a result of injustice and dictatorship, and have to flee their home countries. And because of that, they have an incredible resilience and an incredible innate power, I believe. And if you give them the education, they will be the future leaders. And I think somebody gave a very good example of what women leaders have done to tackle COVID-19. I also saw that article the other day, and I think it's a quite powerful illustration how strong, well-educated, powerful women can change the world. And I do think that the women and girls in conflict and crisis, refugees, have an extraordinary potential. All they need is an education. Once they have it, they are the ones who are going to change the world. Thank you.
Thank you very much for that. And, you know, as an Arab, I can only echo what you've just said about education, and that education cannot wait. And education in a very broad sense. In the part of the world where I come from, there are certain forms of abuses against women that don't even have a name. You often hear women justifying the abuse that they are subjected to, saying, well, that's just how men are. You know, these, they become part of their accepted cultural practices. And I think to raise the awareness of women that some of what's happening to them is actually abusive. It has to have a name, and if it doesn't have a name in the language spoken in a particular country, then we already have a problem. You can't shine a light on a problem that you haven't even found a word for in your language. So I can only echo as an Arab the importance of women's education. Susan, I would like to come back to you. Women Deliver acts as an advisor to governments, corporations, civil society organizations alike on the need for equal rights. To what extent are you seeing governments, corporations, and civil society include women in the design of COVID-19 response policies? And I ask this because, as you might have seen in a number of countries around the world, there has been outrage at the fact that it is principally men who are designing the COVID response.
Yeah, thank you for that question. Yes, we've been actively advocating around the world that in the COVID response and recovery plans, and earlier in this crisis in the preparedness plans, that a gender lens had to be applied and that women needed to have strong leadership roles. And the short answer to your question is we are not seeing enough women in power. And this is a real detriment to the world. Evidence from the OECD shows that when we have women in leadership and decision-making roles, it leads to better outcomes and lower levels of income inequality. But by and large, women, while they're the first responders and on the front lines and bearing the brunt of the care responsibilities, they're often left out of the decision-making processes. And this is no different in the time of COVID. And I'll give you a couple of examples. Here in the U.S., only 2 of the 27 members of the coronavirus task force are women. 2 of 27. And it's not only about ensuring that women are in the decision-making across all levels of COVID response and recovery. It's also about making sure that we're not treating women as one single homogeneous group. There are women of color, women in the informal economy, migrant women, refugee women, young women, LGBTQI identifying people, and more often than not, these people tend to be absent from the decision-making table. And their absence contributes to inequality and policies that do not reflect the needs of the communities that these policies are designed to serve. And so you're having real gaps in leadership and real gaps in understanding the true dimensions of the crisis and what's needed for the response. And I think that's truly one of the reasons that's contributing to these inequalities and this rise in number that we're seeing disproportionate effects that the crisis is having on women. But it's not all bad news. We're also seeing new calls for women's leadership in COVID and decision making. And I want to applaud the UN Secretary General. He's been really, really clear about the importance of having a gender lens and a gender response to COVID-19 in a lot of his policy briefs and a lot of the policy papers and in the frameworks that he's rolled out this spring. He recognized the centrality of girls and women in the response. And at the at the WHO's World Health Assembly, there was a resolution that was adopted by more than 130 countries that recognized the need to involve women's participation in all stages of decision-making processes and to ensure that gender perspectives are mainstreamed across all of COVID response and recovery. At the WHO, you're also seeing examples of women's leadership. So last week, the former Prime Minister of New Zealand and a Women's Labour Board member, Helen Clark, was appointed alongside the former president of Liberia, Ellen Johnson Sirleaf, to be the co-chairs of the WHO Independent Panel for Pandemic Preparedness and Response. And this group is going to be responsible for evaluating the world's response to the COVID pandemic. So you are seeing examples of hope. And at the national level, you're also seeing examples of hope. For example, Women in Global Health, it's an organization that advocates for more women in leadership and health positions. And in Somalia, the chapter of Women in Global Health worked very closely with local NGOs to advocate to the Somali government that they involve women's expertise in healthcare in advisory roles and in positions of decision-making. And a key call from this group has also been to ensure the release of gender and age disaggregated COVID-related data. And the government has just started to do this. So there are some signs of promise, but there is much work to be done still in order to make sure that we're truly reflecting the needs and the realities of everyone who are being confronted by the risks, the challenges, and the inequality related to COVID.
Thank you very much for those comments. And I'm happy to hear that there's more work going on gender and age disaggregated data. That's certainly good news. However, when you say that 2 of 27 members of the US's coronavirus task force are women, I wonder if we can continue to just call this a gap. This is really much more than a gap, and I'm very happy we're having this webinar. This is a real crisis, actually. Josefina, you put the spotlight in your previous comments on economic rights and the need for the economic empowerment of women, even as a response to violence. Now, you were vice president for many years of an organization that's often described as the Hand of God, IFAD, a development agency that goes where no other development agency does. Talk to us about the concept of gender-sensitive development as you've seen it in that role.
Yeah, thank you, Doa. Let me better refer to the phrase building back better, which I think everybody is aware that there is no new normal, that we will have to build that new normal. What I would love to even propose here is that let us start talking about building back better for women. Because if it is that we are going to build something that is better than we had, it has to include women, and it is an opportunity for us to include women. And that's what I said, that I think that we have to have many of these conversations, because there will be a lot of work to be done in order to really bring women to the core of the discussion, not only of how to respond during the emergency, but also how to build back better, making sure that women are not left even farther behind than when we were when the crisis hit. I believe that in restoring and in moving for development, I don't know how far we are going to achieve the SDGs, but in order for the world to be as close as possible after the pandemic, women have to be an essential part of the economic reconstruction of the countries, and not as a recipient only, but also as a main actor. And what do I mean by that? I mean that we have to make sure that women, small and medium enterprises get more access to credits than they had before, more access to technical assistance than they had before, and that they have those who are employed in the formal job industry, as I mentioned. Let's take the example of the tourism industry, that their working rights are respected, and that because or with the excuse of the economic situation, they don't earn even less than what they were earning before. So bringing women into the economic reconstruction of the countries in a model that is more inclusive is going to be absolutely essential for more sustainable development. Let me speak about the issue of food production, because I believe, looking at the example of my country, the situation will be so hard that we will have, at the same time that we reconstruct the economy, we will have to make sure that food security minimally is guaranteed for everybody. And again, women play a fundamental role in producing food that is then distributed to the countries. Yet, women, again, do not have enough access to land. They do not have access to technological packages. They do not have access to credit. In that new building better, we need to make sure that women get more access to those, because their contribution to food security at home and for the whole country will be absolutely fundamental. The other one is that we are aware that there are people who are going to, millions of people who are going to fall below the poverty line and who have no assets. And again, within those, I include African descendant women in Latin America and indigenous people. Conditional cash transfers need to continue, but need to be better targeted and need to be less intervened by politics. So it goes really to the people that are in need, where women remains as the entry point of the conditional cash transfer for the household. The third one I really want to touch upon in the development model that we need to look at is how do we protect women's assets in this crisis? We see that land property is something very shaky for women. housing property is very shaky for women because the laws and regulations of the countries have not been designed and implemented with women in the center. We really need to work on that because your assets is the only thing that you have if you are left with any after this crisis to make you resilient for the next crisis. This is to say that I believe that once we go through the worst part, at least in Latin America, we are going through the emergency part, really. We need to start thinking about how to build back better for women, and that should include economic, education, health, and basic rights for women. And that is part of the very, hard work that we have ahead, but no one can do it better than women for women. Thank you.
Thank you so much, Josefina. Women in economic reconstruction, how right you are. We need to go back to the fundamentals, property rights, access to subsidies for small and medium-sized enterprises, and that menu that you laid out. Saima, let me come to you. As daughter of the Prime Minister of Bangladesh, you wear a number of different hats. How, in your view, can we prioritize child and maternal health in a pandemic? And for this particular COVID crisis, is there any immediate set of actions that can be taken to help?
Thank you so much. It's very interesting as I'm listening to all of the other speakers and the points that they have brought across and the urgency that's needed. To come to the point about leadership of women, we in Bangladesh truly have seen a significant difference in keeping women at the center of all of our economic and social activity because our Prime Minister is a woman. And in the last 2 decades, the system that has been in place, the priority that has been given to girls' education, girls' healthcare, all of that has come in tremendous use during this crisis. And that's why, other than the group of women who are dependent on working in factories, on working in daily earnings, that they don't have that, when it comes to healthcare, the community-based health centers have already been created. They have been kept active. And that was one of the first decisions that was made, because again, it is a woman who is making that decision. The things that need to be priority is food security for the women, food security for the children, ensuring that relief funds goes directly to the women as easily accessible as possible, using the infrastructure of our money transfer systems with the phone, thinking of solutions straight up for the most vulnerable were already sort of set up, but they were part of the agenda as soon as the crisis really started. So we have, trainings that have been conducted. So as soon as the crisis and the lockdown started, education wasn't something that was an afterthought. Our parliamentary system has a television channel that was immediately sort of selected to provide free education and continued learning. Now, saying that does not mean that it's necessarily happening for everybody unless they're accessing it. But the fact that it was kind of considered is really important, that it was made available. And for Bangladesh, it really has been, this crisis has been an opportunity to learn, to make and find out what are the things in the system that don't work, and perhaps refining it. So for example, for a long time, we've been wondering about how to get medical professionals, doctors, allied healthcare professionals to learn through the use of technology and to teach them, get the resources to them. That has already been a practice and in place, because due to lockdown, we can't utilize that. So once these are systems that are new, have not been utilized for this purpose. So implementing that and using this crisis as an opportunity to refine it, make it work better are, key to that. Women's health, making sure that, deliveries are safe. We've been working for the last many, many years to make sure that deliveries happen in healthcare centers rather than home births, which are unsafe. So you training community health workers to provide that. The system was not closed down. That was considered a priority. Reproductive care, maternity care, those were priority areas. And again, that is a reflection of the fact that we have a woman in power and she's making the decision. So, you know, I almost wanted to kind of join in all of the other, you know, conversation and issues that are being brought up, because you know, our system may not be completely perfect and we're not meeting all of that. Of course, we have our challenges, but we've thought of these issues straight up, because the problems when in a crisis situation, you cannot think from a point of view of what you're going to do in a crisis. You have to have those priorities set first. So even, you know, the group of people like those with living with disabilities, you know, the groups of people who are extra vulnerable, who are living in much more remote areas. We have a rainy season now, so places that are flooded. How do we get, you know, food sources to them? Those are priorities that were made. As soon as the pandemic pretty much started and we were expecting it, we knew one of the core issues was going to be food shortage. So ours is an agriculture-based country. So ensuring that there's no stoppage and no breaks in the agriculture production. We've even had our civic leaders, political leaders, volunteers go into the fields and help harvest. You know, using protective gears and stuff. They have been there to not just help because help was really needed, but to also ensure that this is something that is a priority. And again, the issue then becomes, how do you transport food to the families that need it, making it accessible in places where it's not being produced. So keeping certain industries as a priority, and then slowly kind of recognizes that you know, the economic and the health services need to kind of come back on, because a country like ours and many countries, they cannot survive in this continued crisis situation. You have to make sort of change your mindset on how to become much more functional. I think with this COVID, a big part of the issue is that the fear people have of transferring, fear of you know, not having the right healthcare, fearing not having the treatment. So all of that is kind of almost preventing people from venturing out even in a safe way. So, you know, educating them from the beginning on many of the safety measures, on, you know, things, even at the, you know, most rural communities, about washing hands, these kind of practices that are very hygiene-based practices, very basic things. That was part of the agenda from day one, because you know, it is, so you can see everybody in Bangladesh kind of coming out now, with trying to ease up, because economic activity affects everything, and it's you know, the well-being of the whole country. And so, and not just that, it has had a huge toll on the mental health of everybody, not just women. So, you know, looking at it holistically, I mean, that has been key, and we have been very fortunate. Now, one of the biggest challenge with using our technology-based, you know, video conferencing for regular oversight is that you're reliant on the persons who you're asking to report the truth and the facts. And, you know, I hate to throw, you know, men under the bus, but you have a lot of men there. And unless they understand why the women's clinic is a priority, or the service providers need to be there, it's hard to ensure that it's being implemented, even though it's a policy. So big challenge, it's oversight, making sure that that takes place. That has to be considered.
Thank you very much, Saima. Indeed, women in leadership. Women in leadership put the spotlight on a completely different set of issues. And you've spoken about maternal health. And I would just like to say from the perspective of my part of the world, the Arab and the Africa region, health, violence, and education, or the lack thereof, are very often represented in the very unfortunate issue of female genital mutilation, which is still a critical issue in many parts of Africa and many parts of the Arab world, and the numbers are extraordinarily high in some countries. So this is just a little example of how the rights of women are taken away right from the minute go, right from the start. As they come into the world, this happens to them. And how, as Josefina said, we need to build back better for women. Catherine, let me come to you. Humanitarian agencies talk about the need for emergency preparedness, guidelines and protocols for the immediate rollout of humanitarian assistance when there's a crisis. How would you apply a gender lens to emergency preparedness going forward?
I think there are several things that we can do. And when I say we, I mean, I don't think it's just the job of the big agencies or the NGOs or anybody else. Because circling back to what Yasmin referred to when she talked about the humanitarian summit, there was a strong movement there that there should be much more community participation and leadership, and not just top down from some capital somewhere or some headquarters of an agency. So with that in mind, and if we are really talking about building back better for women and being more inclusive, as Yasmin and Josefina said, and also in having women in more leadership, as Susan said. I want to put this in that context, the things we can do together for preparation for emergency relief. One of them has been highlighted in many different ways, and that is schools. If schools aren't back in place, one of the things we've got to absolutely be sure that we do is feed children. And so many children are able to eat at school. Not everybody yet, but in many places. And in fact, it's a recruitment tool a lot of times for girls to go to school, or to convince fathers to send their girls to school. So one thing the community can do is to be sure that there's still an opportunity to feed children. For instance, if there's no schooling, community groups could get together and provide food at the school, or in some cases, deliver it, or put it in locations, deliver it in locations where there's large numbers of young people. So that's really, I think, very important. There's a group called the Global Child Nutrition Foundation that has some guidelines for doing this. Second is, and of course, if there is school, then put school feeding in right away, because again, it's one of the things that brings girls back, or can bring girls back. Second is using radio for distance learning. And we're, you know, in the North, we're doing things like this. Well, we're not all in the North, wherever we are, we're Zooming. We can't do that for kids all throughout communities, but using radio for distance learning can be done, and is done in some communities, but it certainly could be much more prioritized. And also for announcements, public announcements. Food banks and collective feeding. Food banks, especially in COVID times, are really important, and they are growing, especially in low and middle income countries. Maybe not in the poorest of the poor countries, but in many countries around the world, there's a network of food banks. And again, the communities can be much more supportive if we can afford to donate food or cash, to be able to donate, because in a COVID kind of situation, going a place and picking up food or having is can be hugely important. It just is important in local markets. Some of the things the big organizations are doing is providing assistance through local markets in the form of cash or vouchers. At WFP, UNHCR, lots of NGOs are doing that kind of work. And then, of course, going back to this issue about community decision-making, and pushing to have more women in leadership in those decision-making venues on any topic, whether it's COVID-related or education, rebuilding, social protection, food production, trade, and food distribution. So I think those are some of the key things. Also, Josefina mentioned rural areas. It's much more difficult to communicate in rural areas than it is in urban. It's more difficult to have access to food. It's harder to walk to school. And so we have to think about quadruple in rural areas. Twice, once in 2011 and then once in 2018, I put together reports for the Chicago Council on Girls in Rural Economies with suggestions to policymakers for paying attention to this cohort, because some of the least often thought of and most forgotten group of people. So somehow we have to redirect policies to be sure that we cover everybody. And we've talked about different cohorts of people who are often not remembered, but girls in economies probably top the list and ought to be paid attention to from a nutrition perspective. So what a big organization is doing to prepare is important, but what we can do in every community in order to build access for women and girls and develop more opportunities for speech, for voice, and for power for those women and girls is really important. And every one of us can do some little or big thing in order to help accomplish that. Thank you.
Thank you very much, Catherine. School feeding, food banks, a range of things we can do, in fact, to strengthen emergency preparedness. Now, I would like to ask something very hard of all of you. We have a lot of viewers on this webinar, and we have an avalanche of questions that have come to all of you, but we only have 10 more minutes. So I don't want to leave the viewers frustrated, which means that you will have to be extremely brief, answer in not more than 1 minute, if possible, some of the questions that have come in. Josefina, I will start with you. Some of our viewers are familiar with your role as Deputy Director of the Enel Foundation, and they want to know what you think the private sector can do to further women's rights. Another big set of questions that has come into you has to do with Indigenous people. What can we do for Indigenous women in this crisis? You have 1 minute.
Okay, I will try to be very brief. Susan, thank you so much for looking at issues like school feeding programs and food banks, because they will be absolutely fundamental, not only in poor countries, but even in middle-income countries like the ones in Latin America. And I want to link that with the issue of the private sector. You have producers who are selling to the value chain of supermarkets in countries. A lot of work has to be done there, and the private sector can play an important role in making sure that producers have the right prices and the right payment at the right time so that the sector can be reconstructed. And among them, many Indigenous people who are selling products to supermarkets. So how do we reach them out with food banks and school feeding programs, but at the same time connect them to the market much better than they were before, because they are also producers. I think there are 3 more areas in which the private sector has a fundamental role in supporting women to come back to the economy and to where they were. The banking sector, for credit, for small and medium enterprises, to really make sure that women have more access and better access to credit as soon as the lockdown is done. Second is the issue of job quality. We don't want to see a return to the 20 years back of women in terms of salaries, protection, insurance, and so on and so forth. So we have to work with the private sector to make sure that women are not left out and behind in the process of reconstruction, tourism, services, etc. And the second, the last one, which is the one I'm closer to, I think is the area of energy. We have been for many years thinking that productivity will happen by itself in communities that have no electricity. We are seeing now, I am learning now, that energy is a fundamental motor of development in certain communities. So we need to try to support and expand, and we are doing so from Enel and Enel Foundation to expand access to energy for all, including for women, to lessen the burden, for instance, of having to go and pick a wood in order to cook for that day. So those are the type of activities which I think we hope the private sector should intervene. There is another sector, which is the health sector in countries like Latin America. I mean, a lot of the health service is already privatized, for good or bad, but I think that a lot of conversations have to take place there because they have been very selective in deciding who to give the service and who not, and it's not the poor necessarily, because they don't have the money to pay for it.
Thank you very much, Josefina. Yasmin, let me come to you. The bulk of the questions that have come in from viewers for you have to do with innovative models of education. Is there something beyond the traditional schooling system that we can think of that can give a quick boost in education and awareness raising at times of crises? If you can be very brief, please.
Yeah, well, innovation today would be to use technology and digital learning as a new way of delivering education, and as a result of COVID-19, would sort of abandon the old way of doing education in the classroom, the traditional way with a teacher and so forth. However, I think that kind of innovation, as useful as it might be, is also very limited because of the lack of infrastructure in many countries today that are affected by extreme poverty and conflict. Sub-Saharan Africa does not have an infrastructure that allows them to go big on that kind of innovation. But that's the innovation everyone speaks about. I think it's a great innovation, but it also requires that we also move towards more socioeconomic equity in the parts of the world where you don't even have the infrastructure for IT, for web-based seminars, for learning through iPads and that kind of technology. So maybe it's a reminder that we need to create a fairer world through real sustainable development and not just by filling holes. Another one that is very important, and I think if you look at the state of the world in general, we have to move towards a curriculum that unleashes the potentials and rather than filling the vessel, actually sparks or ignites a fire in the pupils and speak about value systems that we can find in the UN Charter, peace building, and create also a sense of a common humanity. This is more important than ever. So there's a lot of scope of being innovative, but always bear in mind that those we serve may not have access to it. So we have to be very innovative in the way we empower countries in crisis and conflict and those left furthest behind to actually not only take part of that kind of education, but to shape it together with us and be the ones that do the innovation and what fits their context the best. But there are certain things that we all need access to. We need access to digital learning, and we need access to understand the importance of peace and human rights in the world.
Thank you very much, Yasmin. In the same way that viewers have asked you about innovation in education, Saima, viewers are asking about innovation in health. The bulk of the questions to you, which have come in many different forms, in the end revolve around telehealth. Can we deploy telehealth at times of crisis? Is it a solution? Can you be very, very brief, please?
I think telehealth is an important way to go. And it is really the only solution at this point. Again, we have to go with the fact that telehealth has to be part of it. It has to be a hybrid model. Not everything can be taught on with this system, but I think it plays a very important role. One, it ensures there's ongoing information supply to people. It is making sure that it's much less costly to run in the long run. And it gives you access to a lot of experts. We're using that currently for even getting mental health services. We're using it right now to access a lot of experts for other health conditions, especially this was set up so that people can seek consultations to know if they need to go into seek further care. So all of that can be done through the telehealth system. But again, it's for a country like Bangladesh and for many countries, I think it's yet unexplored to its fullest extent. And this is, it's an opportunity to use this crisis to use it as an opportunity to see how, work out the kinks, see how it's going to be successful, how, because especially for women, it is really the best way to get services. And on top of it, when you're looking at persons with disabilities, that's the best options for them, because then it's much more accessible to them. For mental health, particularly in countries which is so stigmatized, that's again a huge opportunity for that, but again unexplored. So
thank you so much, Saima. Catherine, there's an avalanche of questions for you, but I have to make a selection, so I apologize to some of our viewers. The bulk of questions that have come in as you were speaking, when you mentioned school feeding, a whole bunch of questions have come in from Africa, with people saying, with schools shut, a lot of children are no longer being fed. What do you say to that? You are on mute.
Thank you. I say that this can be a community participatory activity, that the community must get involved in order to solve this issue and not rely on what's not happening from the government or somebody else. There could be groups of mothers, for instance, and fathers who could take each day. I'll take Monday, I'll take Tuesday, I'll take Wednesday, whatever, and go around the community and raise resources in order to have food for that day, whether it's provided at the school or given to the students ahead of time. That's one important way to feed children at school. And it's really critical that it be done. Remembering also in the whole context that nutrition is critically important and that adequate nutrition is very important. And without it, we will be putting Band-Aids on problems for decades after COVID.
Thank you, Catherine. Susan, the last question, many questions have been directed to you, but I will focus on one that's very nice also for closing this webinar. Given that you spoke about women in leadership and how they make a difference in times of crises, viewers are asking, well, how do you get women to leadership? You have a nanosecond to answer this huge question.
Yeah, I mean, you have to make investments from the start in their health and their education and their well-being, and you need to use moments like now. I mean, this is a crisis of the care economy. We're seeing, as Catherine mentioned, the New York Times article, it's come down to you're either working or you're a parent. And this is bringing into stark contrast huge fissures that have existed in gender norms and bringing it to the public attention. Now is the moment for us to, as gender equality advocates, use this moment to be able to put down tracks, to be able to improve gender equality, not only for tomorrow, but for generations to come. And that's why conversations like today are so important for us to be able to shine a spotlight on both the challenges and opportunities that COVID's brought, and the fact that it's causing us all to understand that we can't continue business as usual.
I think in your answer, you've used a very nice sentence, which I'd like to use to close this webinar. We need to use moments like now. And I think that's the biggest lesson from all of this. Let us see what we can learn. I think viewers of this webinar can already see that there are a whole range of issues that need to be tackled. And I think you've pointed us already to a whole range of solutions as well. So let us make sure we use moments like now. Thank you so much to all of you. This has been a fantastic webinar. Thank you to IPS once again for organizing this. Thank you, Farhana, and for everybody behind the scenes who's made this very important conversation possible. Goodbye.
Thank you all. Bye-bye.